Second speaker, Mr. Pastakia.
A very good morning to the entire elite medical fraternity present over here, the experienced surgeons and the freshers joining the bandwagon. Let me introduce first myself. I am Khushroo Pastakia, Executive Director, Eon Meditech, delivering a brief talk on ear ventilation tubes. Before embarking upon the journey towards this subject, let's have a quick wrap up on what Eon Meditech is all about. It's there in the market since last 2 decades, having presence in almost 100 plus countries around the world, with accreditations and certifications from all the major global notified bodies. Some of them are listed over here, and many more. Some glimpse of our state-of-the-art manufacturing infrastructure, largest in Asia, churning out 1 million units per day production capacity. That's our product basket that includes otology implants, rhinology implants, laryngology implants, ENT instruments, plasma system, absorbable gelatin sponges, and PVA dressings. In fact, we are the largest manufacturer of PVA dressings in the world. Okay, so coming back to the subject, the entire subject revolves around 2 things, that's Eustachian tube and the tympanic membrane. As far as the Eustachian tube is a healthy one, it locks the back of the nose, but in case of adverse circumstances, the liquids do get sucked up due to the negative pressure, and that leads to the otitis media. The primary clinical indications could be recurrent acute otitis media, where the occurrence is frequent, treated by antibiotics, but then the occurrence keeps on and on. The second one is chronic otitis media, where the liquid stays there for more than 3 months, and that's a warning bell. And the third primary clinical indication could be the hearing loss. As you can see in the image, that's otitis media, the transparent fluid, and the second one with effusion, where you can see the bulgy tympanic membrane. So normally these otitis media will go away on its own maybe in 1 or 2 weeks, but if it stays there for more than 3 months, then it's a cause of concern, and going away on its own is almost impossible. So that may be leading to hearing difficulties, permanent hearing loss, brain infection, that could be epidural, subdural, or even brain abscess, mastocytosis, that's like ear bone infection. It can lead to even ear tumor, and cholesteatoma, like abnormal tissue or skin growth in the middle ear. So in all these cases, removal of the otitis media becomes inevitable. And like a small incision is undertaken with a myringotomy knife, 1/20th of an inch, to remove the otitis media and to maintain the pressure balance between the external and the internal environment. As far as global statistics is concerned, Tympanostomy and myringotomy tops the chart in the otology surgery, with almost 10 million plus surgeries done worldwide. Though this number could be much more, but doesn't get reflected because it remains neglected in most of the underdeveloped and developing world. Mostly these surgeries are done in children below 6 years of age. As far as myringotomy and tympanostomy is concerned, it's mainly risk-free surgery. But there are always an exception, and those exceptions can lead to some potential risk that includes permanent perforation in the eardrum, scarring or hardening of the eardrum, affecting the hearing, infection or chronic drainage. Grommet can become blocked due to thick liquid, maybe pus or some debris, and chances of medial migration that we'll be talking about in the later slide. So the solution is implanting a middle ear grommet. A lot of designs and a lot of different sizes of grommets are available in the market. Eon Meditech also has a wide portfolio, comprehensive portfolio in its range. It's manufactured under metal, fluoroplastic, and silicone materials. It's available in a standard format as well as with tail and with wire attachments, and for adult and pediatric configurations. These tiny medical marvels are manufactured under precision advanced micro machining technology following the rigorous quality control protocols that adheres to the strictly defined tolerances that passes through all the biocompatibility testings and ensuring that it remains in place in the tympanic membrane for the desired period. Also, ready-made myringotomy kits are available. Eon Meditech also has one in its portfolio. It's a disposable stuff. Like every surgery, a surgeon can open a new kit, do the surgery, and then dispose it off. Exception of the alligator forceps in the kit, rest all are disposable items. Coming to the materials from which the air ventilation grommets are manufactured, the first one is the metal. Normally it can be titanium, and in some cases even gold-plated silver. As far as titanium is concerned, it enjoys the best strength-to-weight ratio, making it ideal for the delicate implants. As far as the middle ear prostheses are concerned, it delivers the best of the results, delivering excellent sound conduction. It's there in the market since last 75 years, having an excellent biocompatibility and having high corrosion resistance. It can stand n number of sterilization processes. Being non-magnetic in nature, it is MRI compatible. It also has an ability to osseointegrate, that is bonding with the bone, which is not applicable over here, but definitely for other implants, it is a very advantageous point. To sum it up, it's like a durable, ductile, long-lasting material with a varying flexibility. Second material that is used is silicone. There are various types of silicone available in the market, including industrial-grade silicone, medical-grade silicone, food-grade silicone. And even in medical-grade silicone, there are hundreds of configurations, and one needs to figure it out. The best one that passes through all the biocompatibility studies, and manufacturers do need to carry out a lot of experiments to find out that material. As far as silicone is concerned, it's an inert material. It's there in the market since last 60 years, and we have been coming across a lot of silicone implants since last so many years. It has a wide range of temperature resistance from minus 60 degree to plus 270 degrees centigrade. Again, it's a soft, flexible, elastic biocompatible material, ideal for ear ventilation tube where one needs to a little bit squeeze it off and then put it across the tympanic membrane. And it can again withstand n number of sterilization process. Being very smooth, it helps in ensuring that the bioload doesn't get the adhesion to the material, and that's why it's more preferred also. Third one is fluoroplastics. It has gained wide momentum since last couple of decades. Again, it's there in the market since last 45 years. Its chemical name is polytetrafluoroethylene, PTFE. It consists of fluorine atoms covalently bonded to the carbon atoms, making it high performance material. The major plus point of fluoroplastic is that it enjoys the major advantage of the price-performance ratio. And that's why it has picked up very well in the market, and it has even crossed now the silicone material, which has been the widely used product in the world. It is like pure, inert, and biocompatible material. Again, it can stand various sterilization processes. It has a long-standing durability. It can remain there for years together. Having a microporous in nature, it is air permeable, making it very soft and spongy. Not exactly a replica of silicone, but still it has some features of a silicone. That's why it has gained more momentum in the market. Normal questions that do come along, where surgeons do ask that why this ventilation tubes are more expensive and why these are less expensive. The major reason is the quality of the product, and the results are most seen in the patients, the impact on the patients, and in some cases it remains hidden forever as to what went wrong. So the variations could be because of the material, identifying the right material as far as even the fluoroplastics are concerned. There are like hundreds of fluoroplastics, and finding out the right one that matches the anatomical requirements, that matches the biocompatibility is really a tough task. So that adds to the R&D expenditure to finding out the right configuration. Next is the design variation. Again, a lot of trials need to be undertaken to figure out the compatibility of the product on the patient's anatomy. So that adds to the cost. The regulatory variations, like $1 million is spent across every block of years for getting all the certification from the global notified body. That again adds to the cost. And of course, infrastructural variations, where the production and the packaging nuts that needs to be done in a highly controlled environment. That again adds to the cost. So you will come across a lot of products in the market where you will find somewhere from $1 to $10, but then everything depends on which parameters the product has gone through. These are the list of biocompatibility testings what are undertaken. That includes hemocompatibility test, sensitization test, cytotoxicity test, irritation test, acute systematic toxicity testing, pyrogen testing, genotoxicity testing. In fact, most of the big manufacturers have a big team of a microbiology lab to calibrate the environment in which the product is manufactured, as well as to test allergenic load on the product, whether it is having an impact or not. Normally, these ear ventilation tubes are designed to extrude on its own. Say for a couple of months, it needs to stay there and then come out. But in certain cases, it may extrude before the desired timeline. The reason for extrusions could be the product-related factors or the patient-related factors. As far as the product factors are concerned, it could be ventilation tube material, it could be the design, it could be the size of the flanges. As far as the patient-related factors are concerned, it could be the reason for the previous history of the patient, level of pressure and inflammation built up behind the tympanic membrane that also may lead to earlier extrusions, type of fluids behind the tympanic membrane, the thick one, the pus or serous or gluey material can also lead to excessive pressure. Level of postoperative ear infections can also be a cause of concern. Then there is a technique of strict rotative insertion. Many surgeons try to get the grommet into tympanic membrane for ensuring that it has been properly placed, but again that leads to more gap in the tympanic membrane perforation. That leads to more wobbling of the grommet. Even the location of the incision also plays an important role in this case. The ideal location is not the central portion, but it's the lower anterior inferior quadrant where the grommet needs to be placed. As far as medial migrations are concerned, it's like dropping of the ear ventilation tube behind the tympanic membrane rather than coming it outside. And it could be because of either the technical error from the surgeon itself, where the incision is made quite big. The level of infection can also make the incision more broader, and that can also lead to medial migration. Sometimes biofilm formation because of the bioload can again create negative pressure and pushing the grommet behind the tympanic membrane. And Eustachian tube, non-functioning Eustachian tube, that can also lead to medial migration. The ear ventilation tubes can be classified on the basis of their durations. Normally classified as like short-term, medium-term, and long-term, but I personally feel it's like short-term and long-term. It's the size of the flange and the curvature of the flange that decides whether the tube will be remaining there for long or not. In case of the long-term ventilation tubes, there is no outer flange, so the building of keratin is not there, and that's why it remains long over there in the tympanic membrane. Also, the inner flanges are very big, very broad, and that holds a ventilation tube for a longer term. These are the classifications, normal classifications seen in the market. These are the dimensions. A lot of different dimensions in ear ventilation tubes are seen in the market, with 1.14 inner diameter is the most widely used one. These are the varietals. The most preferred one in the global market is Shepherd, Armstrong, and Shah. Shepherd is preferred because it's having a very smooth structure, leading to a very easy insertion. It provides very minimal disturbance to the tympanic membrane. The pointed knot of Shah makes it very easy to implant into the tympanic membrane. As far as T-tubes are concerned, because of its long lumen and because it doesn't have the outer flange, it remains long for a longer period. As far as the future innovations are concerned, it mostly revolves around the finding out the alternative biocompatible materials, reducing the complications and enhancing the functionality. So finding out new biocompatible material is itself a big challenge. Apart from fluoroplastic, silicone, and titanium, more materials are explored. Then finding out a material that can dissolve after the purpose is served. So exploring the polymers that will dissolve on command. So it will not dissolve in due course of time, but once the purpose is served, after 3 months or 4 months, adding an autopolymer compound, it will get dissolved. Customize 3D printing advancements, which I don't feel could be a better bet because of its time and cost limitations. But still, work is done on that aspect also. Antibiotic releasing coatings are also on the chart, which includes the immersive coating and micro spray coating technologies. In this case, it's for ensuring that the surface becomes more smooth so that adhesions can be avoided, the pyrogen load adhesions can be avoided. The other aspect of future innovations could be avoiding of the anesthesia, because that is having, again, a negative impact on the young children. And bioabsorbable tube or ventilation tubes. This too could be having some limitations on the time and cost involvement, because once the tube is implanted, the biodegradation starts its process. So chances are very less that it may remain in place for a longer time. As far as coatings are concerned, as I mentioned earlier, the purpose of coating is to ensure to deliver a very smooth surface or to release the antibiotic so that infections can be avoided. The other portion in the future innovation could be automation, which Dr. Lim has already presented over here. Up till now, we have seen automation mostly on the mechanical front, whereas the product what Dr. Lim has been discussing over here was on automatic front. This is a small comparison. So as I said, the earlier innovations were there on the mechanical front. Let me tell you that automation has been in the agenda since last 22 years. It began maybe in 2002 or 3. Still now, mostly all innovations were done on the mechanical fronts. This is the first one on the automated fronts. Second thing, what it enjoys is that it can use any market available grommet, whereas the other mechanical ones needs to deploy their own in-house designed grommet. So it's more of a closed system. And the speed of delivery is very fast in this. So dating back to 1649, when a French anatomist unintentionally perforated the eardrum with a spoon to drain out the fluid, to the first documented use of tympanostomy tube in 1845. Then again, getting abolished for another 100 years because the results were not that encouraging. To again regaining its popularity in 1954 by Armstrong presenting with the successful insertions. The journey of your ventilation tubes is quite encouraging and revolutionary. More and more developments one can see along in the market, but time will tell what would be the best biocompatible material, what would be the best technology that will really give better results. To sum it up, the entire ear ventilation tube portfolio depends on the outer and inner flanges, with the short-term ones with smooth diameters and with very smooth flanges or minimal flanges, and the long-term one with no outer flanges so that keratin doesn't build up and that ensures that the tube remains for a long term. That's all for the day. Signing off here with, that's Khushroo Pastakia. Hope you enjoyed the entire presentation. Thank you very much.
Now we open the floor for questions.
No questions from the audience? So I have a question. So out of all the tubes that were presented by Mr. Pastakia, what tubes can actually be loaded to clicks?
Yeah, so for the first version of clicks, we are using the small tubes and the fluoroplastic tubes. Yeah, and the shaft of clicks can actually be redesigned and can be increased in size to fit other types of tubes. But for passing Singapore regulatory FDA purposes, we try to keep with a simple 1-2 tubes first, so that it's easier to pass regulation. And after that, we can always make it bigger, change the tip a bit to fit other tubes. And I think what Mr. Khushroo said about having a very precise slit so that the tube is there for a good period of time is very important. And that is why I think the Clicks device is helpful, because the slit incision that is made for your tube, we can customize it to be smaller than your tube, the incision. So the tube will stay very nicely there. Thank you.
Even as far as the consumption pattern is concerned regarding the long-term ventilation tubes, it's 10% of the entire portfolio for the short-term ones. And most important of all for this automation is it can be very useful for mass camps where there are poor resource settings, where there are no infrastructures. I've been to a couple of even African countries where you don't find even a single ENT doctor in an entire country. So like it's completely a neglected segment in most of the underdeveloped countries. And that's where this type of automation can be of real help, where you can have one point where you don't need an infrastructure, you don't need an anesthesia, and you just can carry on the implantation with a single click. So that could be the major advantage, a plus point of such machines.
Okay, thank you. So I was talking to both our speakers that in the Philippines, we actually use the handmade grommets in our practice. So what's your comment about that?
As far as the different materials and different grommets are concerned, I came across to know about how the doctors in Philippines do carry out the tympanostomy surgery. But the fluoroplastic material is very much price performance oriented, and that could be easily be deployed, and it's most widely used worldwide. So one can easily opt for the fluoroplastic grommets that can deliver the best of the results. Silicone could be more expensive, titanium could be even more expensive, but fluoroplastics delivers the results desired.
Thank you, sir.
I'm sorry, I just wanted to add to what Mr. Khushroo said. So actually, if you think about the price, what is the word you use?
Price performance ratio.
Price performance, I need to learn. So the price performance ratio, actually, if you think about the handmade tube being a month and the fluoroplastic tubes being up to a year, it's actually very cost effective, yeah.
The major advantage of the click portion is one can reuse that gun for n number of shots, whereas in other mechanical counterparts available in the market, the entire thing is a disposable one. So every time you need to buy the entire system and throw it off, where in this case only the shaft needs to be replaced. That's the major cost-saving portion in this device.
So I know that for the others, maybe it's about 500 US to 800 over US, but of course, I mean, that could be different price points for different places, but for ours, it will be a lot more cost effective.
Thank you, Dr. Lim and Mr. Pastakia, and I think we have to end the session.
So with that, we end the session for painters. So if there are no more questions, thank you very much for attending this session. There's no photo at the stage.